So, what if your regular checkup could spot problems in your body even before you got sick? It is not the reality for most people today, but it's the vision of some local physicians.
Yeah, tonight I'm showing you a new preventative scan now available in Arkansas and what doctors say patients should consider before trying it.
Many times we find disease too late.
That idea, catching disease earlier, is driving a growing interest in preventative medicine. Across the country, new imaging technologies are aiming to spot potential health issues before symptoms appear.
We have special AI protocols that we use that enable us to decrease scan time, but also increase image resolution.
You may have heard about celebrities, or maybe even someone you know, getting an elective whole body scan. But the founders of Veralux and Rogers say this facility is the first of its kind in Arkansas.
It's non-invasive, it's radiation-free. Frankly, it's underutilized for preventative medicine.
The team, Doctors Drake and Vanessa Branch, a pathologist and radiologist with decades of experience, along with MRI tech Lauren Hendricks. They believe prevention is where healthcare is headed.
You know, traditional healthcare models are really focused on treatment right now. That's our mission, is to try to help shift that focus away from treating symptoms rather than, catching things early in a more preventative measure.
Now, these scans aren't cheap. They range from about $1,000 to $2,500, and they're not covered by insurance.
The hope is that the future of medicine and insurance and things like that will see the value in this type of service, and will make that more accessible to everyone.
With that hope in mind, primary care doctors say preventative care today still follows evidence-based guidelines, and like any emerging technology, the newer scans come with both potential benefits and risks.
You might find something that you wouldn't have before, or otherwise. If you find something, then there's potential that you might need further tests or biopsies or procedures. And so just understanding that before going in for that test is really important.
Dr. Merritt Turner with Baptist Health in Fort Smith recommends talking to your doctor before getting an elective scan.
The cost-benefit analysis is definitely important to consider as well, especially if you're gonna potentially take on other costs if they find something on that scan that, again, insurance may not cover because of how it was found.
Veralux tells patients this is not meant to replace standard screenings like mammograms and colonoscopies, but to supplement them. To better understand how the technology works, I went through the process myself. I suited up in scrubs, reviewed paperwork, and climbed into the machine. The full body scan took about an hour. With earplugs and headphones, I watched a show while the imaging was completed. It usually takes about a week to get your results. When mine were ready, I went in for my consultation with Dr. Branch.
So today we will go over the results of your imaging that you had.
We went over every part of the scan, starting with the brain to my chest and abdomen. The scan did find a small cyst in one of my sinuses, something Dr. Branch says doesn't require treatment.
Really imaged just beautifully, and you did not even move a peak.
Overall, I got a healthy report. Dr. Branch says for others, the scans have caught serious conditions early.
We can see things ranging from cancer, aneurysms, hundreds of medical conditions. I've seen several patients who've had medical conditions that weren't necessarily cancer, but would have a significant morbidity, and they did not realize.
And for some, like in my case, it's about being more informed about your body.
How'd you like the show?
Something maybe that you didn't realize that was limiting you in your life that you now have the opportunity to correct. Improving, I think, people's life is a big part of this.